Hello, my name is Prabjot Singh, and today I will be briefly discussing about the topographic anatomy of the division regions of the neck. So before starting, let's discuss why neck is a very important structure in our human body. Despite being of a very small region, it contains a lot of muscles, a lot of vessels, a lot of nerves which pass through it, thus making it a very complex structure. It is so complex that it becomes like truly difficult to study it completely. That's why, to simplify it, a lot of regions have been divided into it. So a neck is a quadrilateral region which is limited superiorly by the lower border of the mandible, an imaginary line drawn from the mandible to the mastoid process. Inferiorly, it is bordered by the upper border of clavicle and posteriorly by the anterior border of the trapezius muscle. One of the most important muscle of the neck region is the sternocleidomastoid muscle. It divides the neck into two main triangles. The muscle originates from the clavicle and the sternum and inserts into the mastoid process and the occipital bone. It divides the neck into anterior and posterior triangles. So let's discuss about the anterior triangle. The boundaries of the anterior triangle are laterally sternocleidomastoid muscle, medially the midline of the neck, and superiorly the lower line of the mandible. The roof of the anterior triangle is formed by skin, superficial fascia and platysma muscle, layer investing the deep cervical fascia. The subdivision of anterior triangle. So the anterior triangle is subdivided into many smaller triangles, which are submental triangle, submandibular triangle, carotid triangle, and muscular triangle. So let's discuss the submental triangle first. The borders of the submental triangle are the body of the hyoid anteriorly, the anterior digastric on the right, and the anterior digastric on the left. So it is the only triangle which is unpaired and it passes the midline of the neck. The floor of the triangle is made by the mylohyoid muscle as seen in the diagram. The roof is the roof of all the parts of the neck are made from the skin, the superficial fascia with platysma, and the deep cervical fascia. The contents of the submental triangle are the anterior jugular vein and submental lymph nodes. The submandibular region, let's discuss the submandibular region now. So, the submandibular region borders by the inferior border of the mandible, the posterior digastric muscle, and the anterior digastric muscle. The floor of the triangle is made by the mylohyoid muscle, hyoglossus muscle, and middle constrictor muscle. The roof, again, is made by the skin, superficial fascia with platysma, and the deep cervical fascia. Like other main triangles except the submental triangle, this triangle is paired. That is, it is present on both sides of the necks symmetrically. The one of the most important feature of submandibular triangle is that this triangle creates a lesser triangle. A lesser triangle is a name which is given after a German surgeon. This lesser triangle is anatomically important since it helps to find lingual artery, which is helpful during ligation. The borders of the lesser triangle are hypoglossus nerve, anterior belly of the digastric muscle, and posterior belly of the digastric muscle. The contents of the mandibular triangle are as follows. It consists of facial artery, the sublingual artery, which can be found in the lesser triangle, and the submental artery. It consists the veins of the same name, and other structure includes the submandibular gland, as we can see in the picture, inferior portion of the parotid gland, and submandibular lymph node. Now let's discuss the carotid triangle. The carotid triangle is named so because it consists of all the three carotid arteries in it. It is bordered and by the sternocleidomastoid muscle anteriorly, the posterior digastric muscle, and superiorly by the omohyoid muscle. The floor of the triangle is made by hyoglossus, thyrohyoid, and middle and inferior constrictor muscles. The roof again is made by skin, superficial fascia with platysma, and the deep cervical fascia. It is also a paired triangle, that means it is symmetrically present on both sides of the neck. The content of the carotid triangle are as follows. It consists of common carotid artery with its carotid body, which branches into the internal carotid and the external carotid artery. The main anatomical features which are present in carotid triangle of internal carotid artery are that it consists of superior thyroid artery, lingual artery, facial artery, ascending pharyngeal artery, and occipital artery. It consists of veins which are internal jugular vein, common facial vein, lingual vein, superior and middle thyroid vein. The nerves which are importantly present in this triangle are vagus nerve, external and internal laryngeal nerve, spinal accessory nerve, hypoglossal nerve, ansa cervicalis, which is a rounding back from the brachial plexus, and sympathetic trunk. The organs, the structural organs which are present in carotid triangle are thyroid and larynx. The last of the important triangle in the anterior triangle is the muscular triangle. It is also called omotracheal triangle. It is bordered anteriorly by the border of sternocleidomastoid muscle, superiorly by the omohyoid muscle, and it consists of a midline. Now this midline divides this triangle into two parts, so the midline is a common base between these two triangles. The floor of the triangles are made by sternohyoid and sternothyroid muscles. The roof again is made by skin, superficial fascia with platysma, and deep cervical fascia. As are the triangles, this is also a paired triangle which stays together with a common base. The contents of the muscular triangle is that it consists of superior thyroid artery, inferior thyroid vein, anterior jugular vein, ansa cervicalis, and other main structures such as strap muscles, which includes sternothyroid muscle, sternohyoid muscle, and thyrohyoid muscle. It consists of thyroid gland and parathyroid gland, larynx, trachea, and esophagus. Now, these structures are very important structure which are present in our human body and surgically. So, knowing these triangles are very, very important for a surgeon. Let's now discuss the posterior triangle. The posterior triangle of the neck region has anteriorly sternocleidomastoid muscle as its boundary, posteriorly the trapezius muscle, and inferiorly the upper border of the clavicle. The apex of this triangle is formed by the occipital bone. Now, the layer of the posterior triangle. The roof of the triangle, as other triangles in the anterior triangle as well, are skin, superficial fascia, platysma muscle, and the layer which invests deep to the cervical fascia. The floor of the posterior triangle from above to below is made by the following muscles: splenius capitis, levator scapulae, posterior scalene, middle scalene, and anterior scalene. The posterior triangle is divided into two main triangles, the occipital triangle and the subclavian triangle. Now, this division is made by the inferior belly of the omohyoid muscle, as we can see in green here. So, the posterior triangles. The division of the posterior triangle is done by inferior belly of the omohyoid muscle, as told already. It so The occipital triangle has boundaries such as the inferior belly of the omohyoid muscle, the clavicle, and the sternocleidomastoid muscle. The subclavian triangle has inferior belly of omohyoid muscle, trapezius muscle, and sternocleidomastoid muscle. The contents of the posterior triangles are subclavian artery, transverse cervical artery, and suprascapular artery. The veins are terminal part of the external jugular vein. It consists of occipital and supraclavicular lymph node. Other contents of the posterior triangle are that it consists of spinal accessory nerve, it consists of branches of cervical nerve, which includes lesser occipital nerve, transverse cervical nerve, greater auricular nerve, and supraclavicular nerve. It also consists of roots and trunks of brachial plexus, dorsal scapular nerve, long thoracic nerve, and phrenic nerve. So the clinical significance of posterior triangle is that during lymph node biopsy, accessory nerve which is present in these triangles may get damaged, or there might be some chances of vulnerable injuries of the external jugular vein which is located in this region. So I have referred Gray's Anatomy, Netter's Head and Neck Anatomy, and Head and Neck Anatomy by B.D. Charosia. I hope you like my video. Thank you very much.